Hi, I'm Dr. Anjana Bhana and welcome to my YouTube channel. Today we're doing our first interview for our channel as well as our podcast. I'm so excited to welcome Lize all the way from Durban from Skin Skills. She's one half of this amazing duo. They do postgraduate training for doctors and therapists, all things skin. So I'm really excited to pick her brain regarding two very important things. We're going to have two interviews, one on hyperpigmentation and one on the very trendy CBD. Thanks for joining me today,
Thank you so much.
Lize. And I know it was quite a journey to get here from here to from Durban to here.
Yes.
So I'm so grateful you joined us
Thank
today.
you so much. I'm so honored to be here.
So tell me a little bit about yourself, about Skin Skills. What do you guys do?
So we focus on providing postgraduate training opportunities for doctors and therapists that work in the medical aesthetic industry on any relevant topics that might be trendy or any topics that might influence their successful outcomes for their patients. And we have a membership program, we have monthly webinars that we present, and we also offer various online courses to doctors and therapists in the industry.
Well, I actually went through a series of their online courses during our heavy lockdown. One of the companies ran them, and they have an excellent hyperpigmentation course. And that's a huge problem that we are facing currently every single day in our practices, as well as, salons, medi-spas. It's one of the biggest things that we have to deal with.
Yeah.
So can you tell me what exactly is hyperpigmentation?
Well, hyperpigmentation refers to any disorder where we have an excessive amount of melanin, which is the pigment that is present in the skin being produced. We also get other forms of hyperpigmentation disorders or pigment disorders, which refers to hypopigmentation. So hypopigmentation is another disorder we also see frequently, which refers to a loss of pigment in the skin, but much more common is hyperpigmentation disorders where there's an excessive production of melanin in the skin, and it's also very common in specific Fitzpatrick skin types.
Yes.
And we see it more common in darker skin types in South Africa.
Okay, and then in terms of, through our practice, we see all sorts of patients, ages, demographics, and I know what I do, but personally from your side, is there a difference between patients with a lighter skin or Fitzpatrick 1 and 2 in terms of treatment and patients with darker skin tones? How do you treat them differently?
Change your approach, yeah. So I think with darker skin types you are definitely limited in terms of what you can do safely.
Yes.
We often see additional problems arising from darker skinned patients being treated incorrectly, too aggressively, and not counseled in the correct way so that they understand how to manage their skin condition in the long run. So for me, I really think that understanding the difference in terms of how a lighter skin responds versus how a darker skin responds is key before you start your treatment of hyperpigmentation. And counseling of the patient and understanding how important it is to protect your skin in the sun and to avoid any factors following a procedure that could exacerbate your skin condition even further.
So here we have almost a three-pronged approach. So it's, yes, protecting your skin from the sun, because the sun is the major driver for these hyperpigmentation disorders. Antioxidant protection underneath that, calming the cell down. We're going to go over how this works, for the cell. Calming the cell down that actually makes the pigment, and then the pigment's already in your skin and getting rid of that, exfoliating away. So if you can explain, because I know out there the practitioners and the therapists will know melanogenesis, but if you can explain what melanogenesis means and to people that might be listening, patients with this concern, what is it? How does it work?
So it's important to understand it even from a patient's perspective, because understanding how melanogenesis affects the production of pigment in the skin is important, because if you choose your solutions, you'll know what to focus on with your home care regimen as well as which procedures to choose. So melanogenesis always has a trigger, and the most common trigger is UV radiation, so any form of sun exposure if you're not wearing a good sunscreen. There's also the trigger that is not referred to as often as sun exposure, but that's chronic inflammation, which can come from a systemic source, which is coming from inside the body. An example of that would be an autoimmune disorder that the patient already has, which is causing high levels of chronic inflammation in the body. It can also come from an external source. So sometimes the patient has more than one disease on the skin, such as acne or rosacea, which could cause chronic inflammation that makes the melanocyte, which is your cell that makes pigment, hyperactive. So that's the start of melanogenesis. So the most important things to consider there is a good sunscreen, preferably one that contains an antioxidant, because an antioxidant will neutralize free radicals, which also stimulate pigment production. And then using a topical ingredient in your skincare routine which diminishes chronic inflammation in the skin, so that you can reduce the trigger of the melanin production to start with. The second phase is the transfer of melanosomes into the skin cell where the pigment is made, and that we can address by speeding up cell renewal. So there are specific ingredients such as alpha hydroxy acids, beta hydroxy acids, or retinoids that can stimulate that cell renewal process to reduce the amount of pigment that is made in the cell. We also need to make sure that we are reducing the contact time between the melanocyte and the keratinocyte, which is the skin cell. And that we can also target with retinoids. So retinoids or alpha hydroxy acids is a very important part of targeting pigmentation. The actual pigment that is made can only be made with an enzyme called tyrosinase.
So I was going to get to what are your thoughts on other tyrosinase inhibitors, arbutin, kojic acid, those sort of...
There's so many.
There's so many, yes.
So a tyrosinase inhibitor basically dims the tyrosinase enzyme to prevent pigment from being produced. So there are so many different types of tyrosinase inhibitors, and I always take the approach of looking at the Fitzpatrick skin type and what the skin can tolerate, because some tyrosinase inhibitors are stronger than others, and it might be too aggressive for a darker skin type. I also look at the track record. So does it have any peer-reviewed clinical data which is available for us to actually analyze whether that ingredient works? I also consider what other conditions are on the skin, and if that tyrosinase inhibitor has a twofold or a multi-dimensional effect on the skin. For instance, certain patients have aging concerns and hyperpigmentation, and something like L-ascorbic acid is then great because you're targeting the generation of free radicals and you're targeting the tyrosinase inhibition. For patients that have problems such as post-inflammatory hyperpigmentation, I love tranexamic acid because it has so many anti-inflammatory benefits. If a patient has rosacea or acne, I love azelaic acid because it has so many additional benefits in terms of reducing sebum production.
And then you just mentioned something, post-inflammatory hyperpigmentation. So that's one of the two biggest conditions that we deal with in practices, in salons. And the other one is melasma. And I just, there's so many, while you were speaking, there's so many questions that actually came up, but I'm going to tackle one at a time. So post-inflammatory hyperpigmentation and melasma. And then I know what I'm going to say about satisfaction rate. So once the inflammation or the cause of inflammation with PIH or post-inflammatory hyperpigmentation is taken away, it's a bit, in my opinion, easier to treat than melasma.
Absolutely.
But melasma, it's to explain that it's actually a chronic condition. How do you counsel someone about that?
It's very difficult because it's a really debilitating skin disorder which you can't cure, and there is no magic. So melasma is a debilitating skin condition, and it's so often it's difficult to counsel the patient because it's not a curable skin condition. The reason it's not curable is because melasma is stimulated by hormonal fluctuations, and we have hormonal fluctuations throughout our life. Certain patients are genetically predisposed to it, but there's still a lot about melasma that we don't fully understand.
That's the thing, and I think the important thing is for the doctors and therapists out there is to be honest with the patient.
Absolutely.
So you have to say it's a chronic condition, the way diabetes is a chronic condition,
Absolutely.
and then in terms of treatment, it's lifelong.
Absolutely.
Yeah.
Consistency,
Yes.
and making sure that you follow the regimen every single day, that you come for your procedures at the right intervals.
Yes.
It's really something that you will have to manage for the rest of your life. There's no short-term fix.
Yes.
There's no quick solution for it. Unfortunately, I wish there was, but unfortunately there isn't. And often the approaches that work the best are those ones that have a long-term conservative approach.
Like low and slow instead of, I think people are
Absolutely.
so into quick fixes.
Yeah, that we have to target in the long run, like you said, low and slow.
Okay. They often say religious sunscreen application. So it's also the type of sunscreen you wear. Physical sunscreens are important. And even people who are really good about their sunscreens, there is a missing element, and you mentioned that would be antibiotics. So I'm not antibiotics.
Antioxidants.
Antioxidants. So the antioxidants. So, and you mentioned vitamin C, ascorbic acid, stabilized vitamin C, and how I explain it to my patients, because they're like, why must we take a sunscreen and another something and a moisturizer? It's that old SkinCeuticals trick of cutting the apple in half, and then if you expose it to the air, so atmospheric aging, it turns brown, and it's almost like your skin rusting in a way, because it's oxidation, which is your skin is rusting. But you apply a bit of lemon, which contains vitamin C, D-limonene. It stops it in its tracks. So that's the importance of antioxidants. So there is a lot that goes into treating hyperpigmentation. And then
Absolutely.
the other thing, you mentioned it, especially with darker skin patients, as a person of color, there is also this underlying issue of colorism. So you have to, when a patient comes through, and I think a lot of places experience this, they'll come as if treating hyperpigmentation is what they would like to do, but actually it's a skin color issue. So colorism, like wanting to actually change their skin color, and I think that's where a lot of the problems stem from in terms of botched jobs. Yeah.
I think this really starts with having a realistic expectation of what can and cannot be done safely. And also, I think changing the way we think about our skin color. It starts with one person at a time, and we need to be more realistic about what we want to look like, and give a positive message out that having a darker skin color is not wrong. There's nothing wrong with it. But having a hyperpigmentation disorder, that's where we can step in and treat the system or treat the problem, because if we are trying to treat the patient's skin color, that's when things start going south.
And then just a quick one before we end off, we were talking about it before shooting, would be the IV infusions, tying into this. Do you find any value in the IV infusions? Because it's not actually meant for skin brightening or anything like that. They're more immune boosters, and as a side effect, they may cause an influence on the hyperpigmentation. Do you think there's any value in them?
There's definitely merit in it, especially for darker skinned individuals who lack glutathione in the body.
Yes.
And I do think that it's a wonderful side benefit.
Yes.
I do think you need to be very careful though where you get these strips from, to have it with a qualified doctor, or nurse or practitioner that has been trained and certified to be able to administer a drip.
Yes.
And to make sure that the source of where they get the drip from is a reputable source. But there are some dangers associated with using drips when it hasn't been administered in the correct way.
Lisa, thank you so much for joining us today. It's always lovely speaking to you, listening to your webinars. You are so knowledgeable.
Thank you.
Hyperpigmentation is an enormous topic. I think we could go on and on and on for days about it, and I look forward to actually doing some more of these with you. It's so educational, and thank you so much for your time.
Thank you so much.
So thank you guys for joining us today. This is a huge topic, and if you have any questions or comments, I'd love to hear them, and we'd love to answer them for you. So drop them down in the comments, and like and share and subscribe. Thank you.